move now to a little bit of a panel discussion. We're adjusting a little bit here, but let's begin with coverage. Bob explained the difference between traditional Medicare and Medicare Advantage programs. So this question is for Matt. As an administrator, president and CEO, as the case may be, what do you wish everyone understood more clearly about these two plans?
Well, certainly as a former administrator, a few things that Bob touched on really resonated with me. One was that Medicare will only cover short-term, temporary nursing home stays. Okay, so that's somebody that has a 3-day hospital stay, can't quite go home, you can come to our short-term rehab unit, get a lot of physical therapy, occupational therapy, speech therapy if needed. Length of stay is usually between 14 and 25 days, and then they can be discharged home, sometimes with home care, sometimes without. So Medicare will cover that, but Medicare will not cover, okay, my loved one has dementia, they need memory care, or they need long-term care where they just need to live there because they can't live on their own. Okay, Medicare does not cover that. And that's a common misconception out there. I'll get calls and say, you know, mom is I'm thinking about, you know, maybe having to place her in a nursing home. Her Medicare coverage will pay for that, right? No, she won't. It's long-term.
There are differences with traditional Medicare and Medicare Advantage plans. And he talked about sometimes you might have limited access to care with the Medicare Advantage plan. And I'll give you a real life situation that I'm dealing with right now. We have about 4 or 5 residents that live at our assisted living in East Greenwich called the Seasons. The last open enrollment period, they changed their Medicare Advantage coverage from a United Health product
to an Aetna product. Most of the people at the Seasons, if they need short-term rehab, they want to come to St. Elizabeth Home. Well, guess what? St. Elizabeth Home does not have a contract with Aetna. So it's going to be a challenge. Now, if they have an out-of-network rider with Aetna, it's workable, but if it's not, they're looking at some significant out-of-pocket costs. So there is a big difference between traditional Medicare and Medicare Advantage, and you'll certainly want to understand those as you're making your choices. With Medicare Advantage, there's an awful lot of deductibles, so a Medicare Advantage plan may make sense when you're, you know, fairly healthy, but as you age and you really become a significant user of the healthcare system, traditional Medicare might make better sense. So those were a couple of the things that struck me for Bob's presentation.
Thank you, Matt. The next question is for Bob. What if someone enrolls in a plan but later decides the plan they choose doesn't meet their needs? Can they change the plan?
Great question, and I touched on it briefly. There are certain circumstances that you need to be aware of. If you are enrolled in a Medicare Advantage plan, there is an annual enrollment window where you can make a change at the beginning of the year. That period of time, January 1st until March 31st. The scenario is once you enroll in Medicare, every October 15th to December 7th, you're planning a new plan for the following year. There are changes. A plan is dropped. In Matt's example, somebody makes a change because their plan was dropped. They may not understand who's in and who's out of network. It applies to Medicare Advantage. You can make a change back to original Medicare and back to your original supplemental plan. It's, you know, it's important as your changing needs happen, that you're speaking to loved ones, that you're talking to someone who's aware of the changes locally, whether that be hospital access, physician access, or with the plan, to help you navigate this. So you have choices, but it can be tricky.
Thank you, Bob. I think we're going to see if there are any questions in the audience before we take some prepared questions. So we won't be able to answer questions that are very, very specific to your needs, and we encourage you to speak with the panelists afterwards. But general questions, if anyone has, feel free to raise your hand. Yes?
You didn't mention anything about the penalty if you don't take Part D on time.
So the question is, we didn't mention if you don't take Part D in time, is there a penalty?
There can be a substantial penalty. Basically what happens, it's complicated, right? But some people, maybe in the healthy years of their life, they just take over-the-counter medicine. They're not on any substantial prescriptions. So they enroll in original Medicare and only a supplemental plan to cover the out-of-pocket exposure from hospital care and physician care. And they forget or they don't enroll in a prescription plan. So there's a monthly penalty for every month that you did not have credible coverage, right, that extends. When you enroll in Part D, say it's 18 months down the road, or it's 2 years down the road, or 5 years down the road, they will calculate that penalty, and that penalty carries forward on your Part D premium. Yes, yes, for your life. She wants me to make sure you know.
In the back?
Does that apply to switching from an Advantage plan to traditional?
Great question, because obviously it's something you need to be aware of. Most often, if you are in a Medicare Advantage plan, especially in New England, it includes credible prescription drug coverage as part of the Medicare Advantage plan. So this isn't a concern for you in changing plans to another Medicare Advantage plan. It's just if you move from Medicare Advantage back to original Medicare, you want to make sure that you not only purchase a Medigap or a Medicare supplemental plan, but that you also enroll separately in a Part D prescription drug plan. That'll be your responsibility if you move from Medicare Advantage back to original Medicare. So great question.
Yes, sir.
Explain the difference between Medicare Advantage and Medicare.
So the question, want to repeat the question? The question is, explain the difference between Medicare Advantage and Medigap, correct?
Medicare.
Medicare.
So it's complicated, right? You work all of your life. You've always had an employer with a wonderful HR person that comes to you every year and explains the benefits and makes sure that you're enrolled. So as a working employee, as long as you work 10 years or 40 quarters, you're generally eligible for Medicare system. You have to turn 65 to be eligible for Medicare in most situations. So original Medicare consists of hospital care, Part A, and physician care, Part B. That's known as original Medicare. There are deductibles for inpatient care. So if you just stay with original Medicare, only have Part A, for 2026, if you have an inpatient stay, you have a deductible responsibility of $1,700 in change for this year. With your physician services, there's also a first dollar deductible of $600+. And co-payments for services if you just keep Part B and Part A separately. So Medigap, or Medicare Supplement, helps you pay those additional costs. So you purchase a separate plan, a Medicare supplemental plan, and it picks up your inpatient deductible in most circumstances. Depending on the type of Medicare supplemental plan you have, the most common that I see in Rhode Island is Plan G. For physician services, you would have to pay the first deductible portion, the $283. And then everything after that Part B deductible for physician services, ambulance, durable medical equipment for the calendar year would be covered. So that's helping you pay for original Medicare's gaps. Part C, Medicare Advantage. Now you have Part A, you have Part B benefits, but the Medicare Advantage environment is a contract with an individual insurance company. If you think about it, it really mirrors what you were probably used to with your employer plan. You had United, you had Aetna, you had Blue Cross Blue Shield. In Medicare, the Medicare Advantage plan, you're going to sign on with Blue Cross Blue Shield of Rhode Island, United Healthcare, Aetna. You have to be aware of the doctors, the facilities, and their prescription drug formulary. Those are all key considerations when you make that decision. So it's a long answer to your question, sir. I don't know if I created more confusion or less.
I got one more follow-up. How does all that interface with TRICARE, if you're a veteran?
Well, great question, right? So you have, I can go into the weeds. So if you thank you for your service. So if you have veteran affairs, there are certain levels, but say you're TRICARE for life, right? You use the veteran system. It's really improved. More often than not, when I meet with veterans, they will keep veteran affairs for their primary benefits, and they'll generally add a Medicare Advantage plan because that'll help in oftentimes with prescription access, but also facilities. They may not want to use the veteran benefits all the time. They may want to have extended coverage and care through facilities that are local to them or their doctors that are local to them that may not be affiliated with the veterans benefits programs. So they dovetail. I don't often see veterans enroll in Medicare supplemental plans and maintain veteran benefits. It can happen. It's just not as common as an enrollment in Medicare Advantage and keeping veteran benefits. And that's primarily due to cost.
Thank you, Bob. Other questions?
Question though is a little bit different, and that is I'm not even sure the answer to this. I get a letter every year saying that it is creditable coverage for Champ VA for prescriptions. Because like I said, they forbid, you have to pay for your A, you have to pay for your B, then after that, everything, it's like a supplement, including your prescription benefits. So you can go anywhere you want, and they pay. On the veteran side of it, the Part C, which is A, B, and then C, let's say C, which includes or can include everything that's original care, plus, say, a Blue Cross drug plan. There's no point in really paying for the drug plan for the extra because the VA will provide all those drugs. So I'm not certain that they consider it for the veteran that's credit.
So that-
I'm gonna ask you to summarize maybe a minute in
Yeah,
response.
right, sorry.
No?
So that comes back to our original question. The Veterans Benefit Program being creditable keeps you from any future Part D penalty.
Other questions? Yes?
How do you go about getting a needs assessment scheduled, or how does that work?
Oh, yes, yep, you can, we can talk.
The microphone.
can, sorry. We can definitely talk after this, and I'll give you my information. And simple as that, you can give me a call, give St. Elizabeth a call, and we'll get together.
Okay, great.
Yeah.
All right, thanks.
Any other questions? Yes?
Is there a limit as to short-term care? I know Medicare doesn't cover long-term, but you said the short-term care after injury was so. Is there a limit as to how many times you can go in and out of the hospital or the rehab center in 1 year?
I'm going to ask Matt to answer that. There is.
So it's typically you have 100 days.
100 days?
100 days of skilled nursing home coverage through Medicare. Medicare will cover 100% of the first 20 days and 80% of day 21 through 100.
And that's each year?
Yes.
Ask Matt to come up for some closing remarks, and thank you. It's hopefully been an informative session, and it's certainly a complicated issue, whether we're talking about insurances or trusts or family dynamics. So Matt, can you say a few words?
I think we can all, if we all walk out of here with anything, it's that we have a lot to think about as we get older, and there's a lot to think about, whether it's for ourselves, for our parents, how we leave clear instructions for our children who may be managing our care and finances someday. So there's certainly an awful lot to think about. I think that's probably the big takeaway. And the important thing is you're all here, that you're starting to think about it if you haven't already. And you recognize that you need to start planning for these things and considering what your options are and what you'll do. So we really hope that between what you've heard from us and what we provided in the packet, there's an awful lot of information there. There's certainly resources that you can consider talking further to. And again, recognize that St. Elizabeth Community is here to help, and we provide a comprehensive array of services that one might need as they age. So thank you all for being here.